Hola! Welcome everyone to the doctor. I have a question. My name is Dr. Magda Matanes and I come to you from Israel. So, yalla, let's jump on. Who is with me right now? Today is an interesting topic and let me know where are you watching from and from which country. So, uh, today I want to talk about and maybe you have children, or maybe you are faced with this problem every day and you don't know how to actually incorporate it in your daily life. Hi, Carol. Tag your friends so they can join. Hi, Kermit. Hi, Shane. Welcome into the doctor. I have a question. Let me know where are you watching from and from which country. I come to you from Israel. Hi, Michelle. Hi, Magda. Welcome. Tag your friends and so they can join the live. I'm perfect. I'm perfect. Thank you. So share the live and like it, or tag your friends so they can join in. Hi, Kermit. Welcome. So nice to catch you live. Yeah, me too. Thank you for joining. I'm excited for the topic today. So I was wondering. Hi, Richard. Welcome into the live. Tag your friends. Live from Spain. That's excellent. So I would like to talk to you today about the topic of hygiene. So you might have a child that is playing in the mud, and you're having some dinner, for example, or having some lunch, and you're like, okay, now you have to get a bath. Hi, Serene. Welcome. So the question is, like, I'm gonna tell you a story that we are taught in the medical school, and it's actually very important, and it can save lives, and it can reduce the amount of infections that somebody has. There is a story about a doctor that is called Semmelweis. There is now a university in Budapest named after him because of the discovery that he made long time ago in 1800. Welcome everyone for the live. And the Dr. Semmelweis was one time working in two clinics. So one clinic had a teaching for the medical students, and the other clinic, the second clinic, was for the midwives. So for midwives to deliver babies. And he noticed that some of the ladies that were giving birth having pubertal fever. What is pubertal fever? It's an infection of the female reproductive tract. And he noticed that in the same clinics of both of them, in the midwives section, it was always crowded with a lot of people, and low mortality. So the women at that time in 1800s, they died, or they were not very in technological advancement as today, but they were low mortality, and it was very crowded. And in the first clinic where there was like teaching medical students, they were high mortality, and it was the same procedures. There were nothing different, and he started to investigating why is it different. And as the time goes, his friend Semmelweis died, and by the autopsy, they discovered from his friend Clark, I think, in the autopsy, that he had similar pathology as the woman who died from pubertal fever. So he actually thought, like, what is the difference? Why in the autopsy of his friend he has same pathology as a woman? He was a man, and and the pubertal fever is for women. So he investigated even further, and he noticed that a lot of, in the first clinic where they are teaching for teaching, they were coming out of cadaver. So the students were coming out of autopsies and going into the delivery room, which increased the infection rate. So they were transmitting by their hands some germ cells from the autopsies into the delivery room. I'm talking about here in 1800s, so long time ago. And in that time, it was revolutionary. It was revolutionary. Why? Because he now introduced a system for washing hands before and after surgeries, before and after going into any medical treatment. And this decreased the incidence of mortality in 90%. And Hi Hameen, and they decreased the mortality in 90% in the first clinic where there was teaching. And in the second clinic, it wasn't that much difference because there were no germ theory of disease. So there was no transmission from the autopsies into the delivery room. So my recommendation for you is always wash your hands before and after eating, for example, or before and after touching a dog. A dog has a lot of infections. So if he's outside, so some people, I'm not gonna get into this because, but always if you touch an animal, you always make sure that you wash your hands after touching an animal. Before eating, wash your hands before eating, because all the germs that you had before eating can be washed away before you're eating and putting it into your body. And this can wash your hands. Make sure, like, do not obsess over it. It's not, do not obsess. It's not an OCD. It's just a realization that you need to actually have a personal hygiene before eating, after touching a dog, or doing any activity that you are from outside and going inside. For example, from patient to patient, I wash my hands and I put some septic Septol on my hands. So I don't carry what I was in the past into the future, into the next thing. So always wash your hands, but don't get obsessed over it. And this simple technique can actually decrease the influenza level, can decrease the diarrhea level, and the respiratory infections can decrease them. So this is important in actually reducing diseases that are viral infections that are for today as well. So it's important to wash your hands before and after any activity that is from the outside and going inside. And write down, if you actually encourage your children or you write down, yes, if you wash your hands before eating. And teach your children that, wash your hands before eating. This can decrease a lot of infections and increase the personal hygiene level for every child increase the personal hygiene for every child that you might encounter. So wash your hands before eating and write down, if you teach your children or if you do that, write yes, that I do wash my hands before eating. And I will see you on the next live. Ciao, ciao. Bye-bye.